Hi everyone, it's week 5 in community wellness, and this week you're going to be finishing um, epidemiology and looking at part 2 and really focusing on communicable disease or infectious disease follow-up. Couple of things that I want to point out. We have always been involved in disease surveillance, and historically, even as far back as 1200, in Europe with the bubonic plague, and we certainly have continued um, as both Europe developed and the United States to track communicable disease outbreaks and episodes throughout the country. We have a fairly systematic method of doing that, and it really is very interesting because we do get a lot of wonderful information as it comes from the locals and then the state levels into the federal or CDC. Um, and I want to reference you in your textbook to page 270. And this is a whole list. It's box 15.3 of infectious diseases designated as notifiable at the national level as of 2012. To take a look at it, and you realize how important it is that this information, when these cases are discovered, is reported. Typically, they're diagnosed at a clinic or hospital level, and then they're reported to um, this, uh, the locals, and again, then to the state, and then to the national level with the CDC. I'm going to upload a couple of forms for you to look at as well. How does this happen? There is a form, and again, I'll upload this for you, called the Acute and Communicable Disease Report that is filled out, again, at the local level. It goes to the state of Wisconsin. This is a state form in the state of Wisconsin, our state. And then this information then is funneled through with a system called the National Notifiable Disease Surveillance System, then goes to the feds and the CDC. It doesn't stop there. While they're keeping track of all this information, they then put out a weekly publication called the MMWR, and this is the Morbidity and Mortality Weekly Report. So unusual cases, clusters that they start to see throughout the United States are then published and reported on, and then funneled back to the locals. I actually get a copy of this weekly in my email, so it's something that you can request. The one that I will upload is about the measles outbreak. This is from February 2015, February 13th, and it talked about the outbreak in California from December through February. So again, giving us that interesting information and keeping the locals updated as to what's going on. Another resource that I will upload for you as well, and I think I showed this to you last week, is a um, what we consider kind of the Bible in public health. It's called Control of Communicable Disease Manual, and I will upload a chapter on Ebola for you. And it's not a very long one because we don't know a lot about it. We're learning, and it's 3 pages. And again, this is something, and I want to grab it for you so you can see the cover if I didn't show you this last week, but this is kind of the Bible in public health, the Control of Communicable Disease Manual. And it is just an excellent reference that goes through every acute infectious illness that we know about, and again talks about how to identify it, what the infectious agent is, where it occurs, the reservoirs that they know, or who are the hosts or who can pass it along to other victims, the modes of transmission, the incubation period, how long is it, or period of communicability, and who's susceptible, and methods of control. Some of the chapters or the sections are very lengthy, again, just depending on how much information that we have. So I will put a copy of that as well. One other reference or resource that I'll upload for you is just a one-page listing of all the diseases that we have identified since 1970. So in the last 40 years, just a long list of different kinds of diseases that have been identified and documented. So this is something that's not going away. We're going to continue to struggle with the control of infectious diseases no matter where we're at or what time we're at in our history. Um, a couple of things to consider. Um, while infectious disease many times doesn't cause mortality, it certainly causes illness, loss of work, um, days home from school, those kinds of consequences. And the beauty is for bacterial infections, right now we have antibiotics, but as we all know as healthcare professionals, that may be something in the future that we're going to struggle with because of all the antibiotic resistant strains that we have seen pop up here and there. Um, what's taken its place in our society, again, we're still struggling with illnesses, but they're more chronically um, or more chronic in nature. So we're looking more at cardiovascular disease, stroke, hypertension, diabetes, those kinds of things. As far as the infectious diseases go, I just want to point out again, and I'm sure you have read this, um, the local health departments and the state health departments, and even at the federal level, have police powers, and this is guaranteed through the Constitution. And it gives them the right to quarantine, to isolate patients, to confiscate possessions, to close borders, to stop travel. Um, and it really is with that whole idea that we certainly want to allow people to have their privacy and their personal freedom, but not at the expense of the good of the community. So, for instance, if we have an active TB case, that person is typically, as they're identified, they are quarantined, isolated until we can get them under treatment and where they're not considered contagious. Um, so, as you look at the content this week, just continue to think about this. The other thing that I want to point out to you is again how important this whole system works because of collaboration among community members. And that really is key. We have to have people that are willing to work together and make sure that this information gets communicated and again the steps are followed as prescribed. So it really is important. I think sometimes too, and I know in our last post that talked about um, surveillance and infection control and looking at control of epidemics and pandemics. Um, a lot of you commented on um, some of your personal experiences. And I think as I kind of consider it, that sometimes people or professional staff like yourselves that work at the bedside, and I know I commented to some of you about this, or at um, the in a clinic setting feel that you're not involved in this kind of activity in the community, and you really, really are. You are the professionals that start to see or notice a rise in certain cases of infection. You are the caregivers that may see someone come into the emergency department with unusual symptoms and may actually be qualified as some kind of syndrome illness. Um, I also uh, commented again a couple of times on the post. Just think about it. If the nurse in the emergency department, when our first Ebola patient surfaced in the United States, the first trip he made to the hospital, he was sent home. And it was because no one asked further questions or the right questions. So it is that person at the patient's side that can further gather information. And just think about how things would have played out differently, how some people that became infected and actually survived, that wouldn't have occurred if someone had started to ask the correct questions in the beginning. So I don't want you to ever think that you aren't an important piece of all of this. Um, while it's the infection control nurse's job to report these findings to the locals, you are the people that are working with patients on a day-to-day basis. So just continue to consider that. That's such an important thing. One other thing that I wanted to talk about just a little bit, because I'll be starting to review your windshield surveys this week. And I apologize for being a little late with the YouTube this week. I was finishing up windshield surveys from my face-to-face group. while they're time consuming, they are so really wonderful to view and to read through, because all of you, even when you look at the same community, find particulars that the other person won't see, whether it's the photos that you took or some of the statistics that you gathered. And it really, it's so interesting to see the kinds of results that you do have when you conduct these windshield surveys or community assessments. They're valuable, and this is what the community public health nurse does when she is looking at what the programming needs are for each particular community that she works with. So um, they're really very vital and very interesting to look at. So I do try to provide you with enough feedback to give you, just to really give you a feel for how I think you accomplished this interesting assignment. Now, what you want to do, again, this week your discussion post is to review two of your fellow students' community assessments and, again, provide some constructive comments, um, and maybe what you find interesting, how you compare it to your own, because everybody's um, results are going to be a little bit different. That's why public health programming is different at each of the local levels, because the community is different and provides a variety of services, again, that are not, I should say, that are unique from area to area. But now you want to look at maybe the major program or the major problem that you discovered, or the kind of piece that's missing or something that needs to be addressed in the community. And that's where you want to formulate, or how you want to formulate your community nursing diagnosis and care plan. And again, please, when you are uploading this is your next week's discussion piece. Please don't put it in as an attachment, but put the full care plan on the post site so that people can easily get in and review it and then add their comments. So if you have questions or there's something that doesn't seem to make sense as you're reading the directions, please let me know. As I said, I will be finishing or moving through the windshield surveys for this online group this week and getting feedback to you so that you can utilize that. And we'll continue on. We're moving through the course. We're halfway now. And again, I just want to reassure you that your biggest assignment is completed, and the rest, I think, will fit nicely into the schedule for the course. So I will see you guys next week.